Well, I just woke up one morning and it just happened. I felt like I had a rope around me and somebody was pulling on it, and I broke out in a cold sweat. So I went to the emergency room in Spring Hill, put me on the helicopter and told me they was waiting on me up here at Centennial.
He came into me from the ER. He's having chest pain and he was having problems with his leg, and they diagnosed him with an aortic dissection. That's a tear in the inner lining of the aorta, which is the main artery in their body. It had cut off the circulation to one of his legs and he needed an urgent operation. Potentially, if he hadn't gotten treatment, adequate treatment, he could have lost his left leg.
He put a stent in and he wasn't satisfied with it, and he went ahead and bypassed me.
Vascular surgery has changed immensely.
In the last 10 years, as new techniques came about, it's been very interesting to watch as we were able to do things through needles with balloons and stents and much less invasively.
What we used to do in the older days in making an open incision and visualizing the artery, we're now accessing the arteries in a different place, like in the groin or in the arm.
We repair things or fix problems from inside the vessels, and that's true for aneurysms, it's true for stents in the legs.
We're less and less invasive now and often accomplishing the same goals.
This kind of represents the arch of the aorta. This is an aneurysm, and this is a graft that we put in. I frequently refer to it as the largest operation any human can have, and it's really almost taken this into an outpatient procedure.
For the patient, ultimately, it can be less stress, less time in the hospital.
Vascular surgery, I think, is a very interesting field. It's the one field, I believe, that as a surgeon or as a physician, we could really treat the whole disease, both medically, surgically, and also endovascularly.
We treat patients from head to toe, arteries and veins everywhere but the heart.
Some other fields will dabble and do a little bit of here and a little bit of there, but only the vascular surgeon can take care of the entire gamut of that disease.
So I started out wanting to be a cardiac surgeon and then realized that vascular surgery offered me a lot more options to help the patients.
It was really sort of a wake-up call for him, and he took a lot of positives away from it. He's done great. I couldn't be prouder of him. He has done everything he's been asked to. He's lost a bunch of weight. He's more active than he's ever been.
He's a good guy. I think he saved my life. I mean, he's my friend. For life. He's not just my doctor, he's my friend.
He's had a positive outlook on it. He's turned his life around, and he is his own biggest advocate now, and that's a very satisfying feeling for me.
I don't know nothing about it. I just know what people's told me when they ask me what happened to me, and I tell them, and there are a lot of people that are nurses and everything else, and they say I'm not supposed to be here.